Hey guys, I'm Molly from All Healthcare Careers. I'm going to be performing step-by-step CNA skills to ensure your success on the CNA clinical skills portion of the exam. Before we get started, I'd like to show you this CNA practice kit that we put together for you to practice at home with family and friends. It will be linked down in the description along with a video breaking down exactly what's inside the kit. Let's get started. Before entering the patient's room, I will perform hand hygiene. 2 pumps of hand sanitizer. Knocking before entering the patient's room. Good morning, Mr. Smith. I'm Molly. I'm going to be your CNA today. How are you doing? Is right now a good time for us to do your partial bed bath? Wonderful. I'm going to close your privacy curtain and get my supplies. For this skill, you are going to need a barrier, washcloths, a new gown, a privacy blanket, lotion, soap, and a basin. I'm going to place my barrier on the bedside table. And then I'm going to set out my supplies. I'm going to place the privacy blanket over the patient first. This is going to help maintain privacy and warmth for the patient during the bed bath. Next, I'm going to fill my basin with water, making sure that it's a little bit warmer, but not too hot. Okay. Then I'm going to bring carefully the bedside table over to the patient. And then next, I'm going to put gloves on. And we're going to start with the patient's face, making sure not to have any soap on your washcloth. You don't want any soap to get in the eyes. That could cause potential stinging or irritation. So I'm going to submerge in the water, the washcloth. And then I'm going to have the patient, before we start, if the patient is mobile, put their hand in the water, or I could always get the washcloth and put some water on the back of the patient's hand to make sure. All right, Mr. Smith, can you feel this to make sure that this feels okay? Wonderful. Then we're going to start with Mr. Smith's face, starting from the inside of the eye out, and making sure every time that you wipe that you're folding over your washcloth. And then once you've done the eyes, you're going to just wipe all over the face, over the ears, down around the mouth, upper lip, nose, and nose. Then you're going to place that back in the water. And then next, we are going to undress Mr. Smith's shirt. and making sure that whatever part you're not cleaning, keep covered. Then next we're going to move down to Mr. Smith's neck. And I'm going to get my soap ready, submerging it in water. With a few squirts. And we're going to clean Mr. Smith's neck. Repeating the same fold down onto the chest. And this is a good time to also assess the patient's skin to see if there's any new lesions, any skin that could potentially be red or irritated, working all the way down the patient's chest. Now, if you were working with a female patient, you would also want to be making sure that the folds underneath the breasts were cleaned thoroughly and to check for skin irritation as well. Once I have cleaned all over, I'm going to then place my soap on the side of the basin, making sure that it does not go inside the water. Then I'm going to take the washcloth that was submerged in water, rinsing it thoroughly, and then drying off the patient. Neck, down to the chest and abdomen. Keeping the patient covered as much as you can to, again, give them privacy and to keep them warm. Once I have cleaned and rinsed off the neck, chest, and abdomen, then I'm going to take a dry towel and I'm going to thoroughly dry off the neck, the chest, and the abdomen. And again, if you're working with a female patient, you want to always make sure that you're drying completely underneath any abdominal folds or under any of the breast folds to get all the moisture out so that you don't cause potential skin breakdown. Then I'm going to move over to Mr. Smith's arm and hand. Making sure to clean with soap all the way down, the front and the back, all the way up to the hand, and really on the hands, make sure you get in between the fingers. The back of the hand as well as the front of the hand. And lastly, making sure to get the tops of the fingers and the nails. Placing the soap there, and then I'm going to place a towel underneath so that we don't get any of the soapy residue on Mr. Smith's bed. Then I'm going to come back over to my wet washcloth and rinse thoroughly all of the soap on the back of the arm, front of the arm, and in between the fingers. Then I'm going to put that back into the basin, drying off in between the fingers, back of the arm, front of the arm. And then lastly, we're going to do Mr. Smith's underneath his arm. And then I'm going to disperse of that washcloth and clean with the wet one. And at any time, if you are seeing dry secretions, bodily fluids, you're going to want to change out your washcloths. Then I'm going to dry. And now that I have completed the front part of Mr. Smith, this would be a good time to ask him if he would like lotion applied. If he says yes, go ahead and take a couple of squirts. You're going to warm it up in your hands, and then you're going to start from the top of the neck, again, keeping the privacy, all the way down to the chest and the abdomen, making sure not to get into any folds of the skin, which again could cause skin irritation and skin breakdown. Down to the arm and in between the fingers. Wonderful. And then I will take, before I have Mr. Smith roll over, I'm going to get 2 new washcloths, a wet one, submerging it, and then another one for just soap. And I will have Mr. Smith then roll to his side. Maintaining the privacy blanket. Taking my washcloth that is new with soap, and we're going to do the back side of Mr. Smith, starting from the neck all the way down, cleansing. And to get a good time to assess the skin, looking for any new skin breakdown, any lesions, bed sores, redness, irritation. Taking the submerged washcloth, cleaning off. Okay, drying thoroughly. Go. And then I'm going to roll Mr. Smith's shirt under, because the back of him is clean now, so I don't want to take his old shirt to the clean part of his back. Before rolling him back, I'll ask him, Mr. Smith, would you like some lotion on your back? If so, a little bit of lotion, rubbing all the way around. Applying pressure, but not too much. Always checking in to make sure that's okay. Mr. Smith, does that feel all right? Wonderful. Once I'm done, rolling Mr. Smith back, maintaining privacy. And then I'm going to collect all of my dirty towels to the side. And I'm going to place Mr. Smith's gown. Come over to the other side to remove his arm. Okay, removed his arm out of the old shirt. Disposing this in dirty linens. I'm going to take my gloves off now with the new gown. Which I'm going to place underneath, starting with his right arm. And then with his left arm. draping the gown all the way down. And then I will have Mr. Smith roll back to his side so I can make sure that the gown is completely covering his backside. And to also tie the back of his gown. Mr. Smith, are you still doing okay? Wonderful. Then I'm going to roll Mr. Smith back over. I'm going to remove of the privacy blanket, disperse of this into dirty linens. I'm going to place lotion and soap back into Mr. Smith's closet. Disperse all of my washcloths into dirty linen. Basin back into either the sink or the toilet. Rinsing out the basin. Drying it off. Placing the basin back into the patient's closet. Lastly, the barrier. And then performing hand hygiene. Making sure to wash my hands thoroughly for at least 20 seconds. Getting in between my fingers, front and backs of my palms. Turning off the sink. Removing the bedside table down. Checking in with Mr. Smith before I leave. Mr. Smith, is there anything else I can do for you right now? Okay, if you need me, please use your call light. Exiting the patient's room, if I wanted to perform hand hygiene again, I could. We hope you found this video helpful. For additional resources, click the playlist for more CNA skills videos, or try our 3 free-day trial that contains over 1,000 practice questions to ensure your success on the first attempt.